I'm Wayne Hollinger. I'm a pulmonary, critical care, and palliative and hospice care physician. I was just in college and, had always kind of been interested in science and interested in people and even psychology and that sort of thing. And I grew up in a home that was very oriented to community service and that sort of thing. And I just sort of got to going down this path. Actually met my future roommate in medical school my freshman year, and I guess, to be real honest with you, I asked him what he was majoring in, and he said pre-med, and I said, well, that sounds like a good idea. And I just kind of got on that path and went down it. I had an attending that was particularly good when I was a medicine resident, and he was a pulmonologist, critical care physician, and I liked it, I enjoyed it, and he was good to me, and I think basically he was sort of my role model to become a pulmonologist, and I kind of got down going that path, just like I described about getting into medicine in general, and it just seemed like a good idea, and I enjoyed it, and I followed it through, and that's how I ended up here. My job as a physician has actually changed over the years, and early on we basically took care of a lot of people with asthma and emphysema, COPD, pneumonia, and then as critical care or intensive care unit medicine became more important in a hospital because patients have become sicker with more complications and more complicated, complex illnesses, we began doing a lot more intensive care unit work, and and out of that has grown the need to decide, when you can cure people and when you can't, and managing their symptoms and making them comfortable. So in the last several years, I went back to school and became boarded in palliative and hospice care medicine along with one of my partners. And St. Francis has a full-time program of that now where we really look at patients and make sure that the things that we are doing are things for them and not to them, that we're relieving any burden of pain, discomfort that we can, and make sure that they get benefit from anything we do. And that whole field of palliative and symptom management medicine has really grown.